Cheating. Hopefully that's not harassment. I don't think you're going to say
This
that.
one.
That's not harassment. That's not harassment.
Another thing that would be great is I've got a lot of information in my project, so if you have pen or paper, phone, laptop, or something, be keeping track of any questions you might have as they come up, so that we can talk about them all at the end. That would be awesome. This picture now.
My conference notebook.
And that thing down there will go away on its own, right?
I think so.
Okay. Good morning, everyone. I've got a whole bunch of things for people to look at during my presentation because I think that will aid in helping your understanding. So I've got just 2 syllabi that I've printed off, but I would love it if you guys wanted to pass it around, like thumb through it, take a look. We're going to go through it together. Whoever wants to see. So, I'm going to actually do this way. That works better. Okay. So, my final project is that I wanted to design a new anatomy course that would be better fitting the needs for music therapists. I'll talk a little bit more about my plans for the future at the end, but for right now, we're focusing mainly on music therapists. So when I was trying to figure out my project, I wanted to have something that would not only be applicable to myself and my future as a music therapist, but also to the field of music therapy as a whole. As much as I want to do clinical work, and I love clinical work, I see myself in the future becoming a professor long term. I think that that's my passion, something that I love. I enjoyed all of my teaching assistant opportunities when I was in undergrad, and I think this is an area that I could bring a little more value to the field of music therapy. So, where to begin if I'm going to compile a gigantic anatomy course for music therapists, kind of starting from scratch? I had a lot of different resources that I pulled from, and I've got them all laid out right here. I pulled from the NMT book, I pulled from an anatomy textbook, from medical language terminology, I pulled from the vocal information that Tori was so kind to let me use, and talking about all of the anatomy behind singing, etc. So I pulled from a lot of different areas. And I also pulled from the survey that I sent to all of you guys. I sent it to the team. I also sent it to some of the folks that were in my graduating class at my university because they're working with a lot of different populations now as well. And so I wanted to get a large sample size, which turned out to be about 17 respondents, which in the future, if I'm going to improve on this more, I'd love to have more music therapists respond to this, get an even better sample size. For right now, though, I got a lot of great information from your guys' feedback, so it was really appreciated, and it helped me better focus not only my curriculum that I built, but also the projects that I wanted to have as part of the standards for the course. One of the biggest problems I've found in music therapy classes at my university is that we never get enough credit for what we actually do. So this one's going to be worth 4 credits. It's a big class. It's a lot of information. It's a lot of expectation. It's a lot of outside of time for class things. So I would expect it to be a Monday, Wednesday for traditional lectures, about an hour long. And then Fridays would be skills lectures. This is what's going to set it apart from a traditional anatomy course. So you'd be doing the traditional labeling, learning terminology on those Monday, Wednesday courses, but the Fridays would be dedicated to how does this apply to actually what we use in music therapy. So it's going to be talking about, if we're in the neck unit of the curriculum, we're going to be talking about how about apraxia, when we're talking about the mouth moving up and down. We're talking about like when your vocal folds become worn out, like what are we going to do there? Just talking about applications that you might actually see day to day with clients, with yourself. Here's my syllabus. I tried to make it look as authentic as possible. So there's me. I'm your instructor. Welcome to class.
Did you make up King College?
King College of the Arts is my college.
Oh, it is.
That's,
okay.
Yeah. So also some of the standards in my syllabus are going to meet the standards of the university that I graduated from. In the case that I were to present this to my head of department at my university, King College of the Arts. That's me. And so for our required materials, I've laid out the anatomy textbook that I pulled from the most heavily. I have the NMT textbook because even if you're not trained in NMT, I think it would still be a great resource for students that are music therapists to have an understanding of a specific field of music therapy, especially the very anatomy heavy side of things. And I think it would be wonderful to try and get my NMT training at some point, hopefully soon. And then the vocal faults, the book that Tori let me borrow, I think it's got so much wonderful information in there. And so that would be one that I recommend to my students as well. This is an introductory course, so if we were going to be doing neuroscience or something that were more heavy into brain function, etc., and terminology, I would recommend that this be a prerequisite for more in-depth classes, but this would be the basic class. And then we're going into course objectives. This is another thing that's going to make it way different than a traditional anatomy course. We're working on building anatomical competency in frequently served music therapy populations. So part of my research was that I went into some censuses, some surveys that were pulled by the AMTA to find out what populations are most served by music therapists. I believe the survey was taken, it's at the end of the curriculum packet, which I'll hand out in a second, in 2021. So a couple years old, but it's still going to give me a pretty good idea of populations I might want to focus on. Number 2 is going to be applying anatomical principles to offer well-informed music therapy practice and clinical awareness. So building an understanding of actually what's happening in the human body when music therapists work with their clients and patients. Improving clinical documentation from a human anatomy lens. This actually pulls in really nicely to what you were talking about. A huge thing that separates music therapists from therapeutic musicians is documentation. We want to make sure that we're doing it right, we're being accurate in our terminology, that if, say, we're working in a hospital and someone else on the interdisciplinary care team reads it, they're going to know exactly what we're talking about. We're not just saying they touched the kibasa, we're going to say they extended their digits, and we're like flexing them or something like that. Just a little more descriptive could add a lot of professionalism to the field, I think, that is sometimes needed. And then last, this is the most important one for me, is developing empathy for our clients with whom music therapists interact. We're not just going into an assessment with a diagnosis that we've heard of once. We're like, oh, if we're working with someone that has aphasia, I know exactly what to expect. I know exactly how it's going to affect different regions of the body differently, which pulls into, I'll talk about this quickly before I go into grading and assignments, is that there's a couple different ways that anatomy courses can be led. One would be a systems approach, a systemic approach. We're going to run through all of the different parts of the cardiovascular system, then all the different parts of the respiratory system. But a different way to approach anatomy is if you're doing it in a regional approach, talking about everything that's going on in the neck, then talking about everything that's going on in the thorax, and how they interact with one another. For my course, I decided to go with a regional approach because when we're working with clients, we're not necessarily going to be thinking, how is the cardiovascular system affecting this specific situation? We're going to be thinking, oh, my client's having difficulty extending their arm. What actually is all going on in the arm right now? Maybe a nerve in the brachial plexus is being pinched. Maybe we're having, etc. You guys understand. You've worked in these situations before. And so that's when we go through the curriculum quickly later, why we take the regional approach for this course, for my design of the course. So with grading, I think that attendance is incredibly important because you can read an anatomy textbook any day of the week, but you're not going to get a music therapist's perspective on it any day of the week. So attendance, I think, is really important. Unit quizzes, which would be like a traditional anatomy course where you're getting quizzed on the different terminology and locations of things. The weekly clinicals and skills, so that would be like the Friday lectures, attendance, and then the assignments. Midterm final, and the final project, which is the crowning jewel of this course, which I'll talk a little bit more about. So unit quizzes are pretty self-explanatory. The skills assignments are going to be following each clinical consideration. Focus on your Friday. We're going to be talking about, say, if we're talking about stroke in the head unit. Then in that Friday unit, we'd have either myself or a specialist, I would prefer, come in for a Friday guest lecture and talk about all of the effects of stroke on the specific part of the brain. And then for your assignment, you'd have to do a little write-up on something you learned and how it might apply to a specific population that was discussed in class. The midterm and the final exam would be pretty traditional to what you'd see in an anatomy course, where half the course is covered for the first half, and with terminology matching multiple choice. But here we get to the final project. This is what I think is going to be the most powerful part of this course. it's going to be taking what you learn in anatomy and actually making it effective, actually bringing it with you to your practice. So you're going to be doing a case study. You're going to be choosing either a diagnosis or a specific characteristic that was listed in the most served populations for music therapists. So like Down syndrome, Alzheimer's, epilepsy, cancer, seizures, deafness, hard of hearing, contractures, all of these things. You pick one, and then you keep track of all the anatomical considerations. You're going to run through each region of the body that we study and talk about how this characteristic or someone that is part of this population might have differences from the young, healthy, slender, cisgender man or woman. And so that you are aware of how their diagnosis affects different parts of the body. And then with the music therapy domains, you're going to be addressing the 5 different domains that we are always addressing, and talk about how they also might be affected or might be a larger area of need for this population. So say if we're working with someone with Alzheimer's, then maybe cognitive and communication are going to be at the forefront. Maybe if we're working with someone that has Down syndrome or another developmental disability, we'd be focusing mainly on sensory self-regulation and communication. So talking about which ones would be your focus if you were working with this client. And then talking about music therapy settings. This is another area that I find myself and a lot of my peers had trouble with when we were in undergrad before we came out to internship, is an awareness of why do we have one-on-ones versus group settings, talking about the pros and cons. So if you were going to recommend that a person with this population or diagnosis was going to receive one-on-ones versus group, talk about why. What would be the pros for group versus one-on-one or a con? And if you want a little bit of extra credit, designing something you might do with this population or with this diagnosis in a one-on-one versus a group setting. This way, you are getting a very thorough understanding of a specific diagnosis, how it affects the body, and how you might apply this or translate it to a therapy session. And bonus, every student that compiles their resource is going to put it into a team, I keep thinking in therapeutic terms, into a class file. And so then everyone has access to their peers' documents. So they have this huge binder full of resources. Hey, if I have a client that comes in that has this specific type of cancer, I can open that file, read up all about it, and even maybe get an idea of an intervention that would be great to apply. So then you're not just taking anatomy, learning all the different foramen in the skull and being like, well, no, I didn't need to know that anymore. You actually have a resource you're going to use in the field. The grading scale is up to interpretation. This was the grading scale for my university. And then tips for success, the professor that's leading this course can give their thoughts on what they want for a tip, but one of my tips that I led right at the top was, as we're going through the course, just keep track of the different diagnoses or the different regions, the different characteristics that are calling to you so that you can start compiling information earlier in the course than instead of just right at the end like something I might do. At least I'm about this. The academic calendar is incredibly empty because I haven't had the opportunity to put this into practice yet. But with practice, I would love to build this more. So far, all I've given is a general overview of how long I think each unit will take based on how content heavy it is. The biggest units are going to be the overview, the head, the senses, and then the music therapy applications plus conclusion. So that brings me pretty nicely into our curriculum. The last couple pages of the syllabus are just university acknowledgments, things that you're required to keep in a syllabus according to the requirements of your university. So let's get into the curriculum. We got a few minutes. We're doing great. They're beefy. I'll pass them around. Start wherever. Who wants it over here?
We'll start
Okay.
Back row.
This is just for your reference because I'm not going to be able to touch on everything. But if you want to like look through at specific regions, like, oh, I'm really looking for this, you are more than welcome to. So here's our curriculum. The 10 units we've got are an overview basics. Then we're going neck, back and thorax, abdomen, pelvis, lower extremities, upper extremities, head, the senses, and then music therapy considerations. So the basics is a really big unit because, as we know as musicians, repetition is everything. With repetition, we get a better understanding, and with each pass over it, we learn more. So in the basics unit, we're going to be going over a mini version of the systemic approach, learning the basics of each of our systems, the integumentary system versus the lymphatic system, separating that from the cardiovascular system. What are their roles and the big components so that when we see it in the regional units, we're like, oh, I know what that is, or I know why that's there, or I know generally how the structure of that sitting next to the structure of this thing, how they're going to interact with one another. And we're going to bring a big focus into the why. And we're going to be constantly kind of pounding into the students, why are we studying this? Why is this applicable? And like all these things, to build medical competency, bringing it back to our objectives, the scientific applications of music therapy, bringing awareness to the diagnoses and characteristics that are prevalent in our clients. And yeah, there's the repetition thing there. Learning the language of anatomy is really important right off the bat because most of us don't speak Latin as a second language, and that's pretty much all of anatomy. So learning the importance of, like, itis, it just means swelling. So if I have Achilles tendonitis, then I have swelling in my Achilles tendon, something I actually have, fun fact. So, like, then if you're looking, it'll just build competency overall. If you're looking at an assessment form, if you're working in a hospital setting or on a care team, you'll know what certain terms mean instead of having to Google everything, because that's why we go to school, so we don't have to Google everything. And I thought this was an important part to include just because it's something I'm passionate about, using inclusive language when we're talking in anatomical terms. Specifically when it comes to something that I'm passionate about is studying cisgender anatomy. Something that doesn't get talked about, or at least hasn't been talked about in the anatomy courses I took, is that when we're studying anatomy, we're studying, young adult, 20-something-year-old, slender, healthy, cisgender bodies. And that's almost never who we actually work with in the field. And so just bringing the knowledge of this body is not probably what a body will look like that I'm actually working with. And when we're talking specifically in units that are talking about secondary sex characteristics, like in the pelvis area, specifically mentioning this is an assigned female at birth body or a cisgender female body, instead of that's a girl's body, because that means a different thing. And using the right words, I think, is important because it brings more power to what we're actually saying. And then anatomical position is another big part of this unit, because if we can understand the anatomical position, then when we're documenting on specific movements, we can use the exact words that would actually reflect what's happening in our clients. The arm, extend, I'm not going to use all the terms right now, but you know exactly what it would mean if you were going back and reading on it. And it helps us, because if a movement changes subtly in our client, where movements are a huge focus, say if we're working with someone that has a lot of unintentional movements in their arm, then we can look back and be like, oh, this is a repeated motion they've had. This, just bringing strength to our documentation. And then we've got all of our systemic approach there. And then, oh, we're doing great. We're doing great. We'll get done in 20. Okay, so in our neck and jaw region, we're starting here because I do not want to overwhelm the students by starting with the head. There's too much going on. So we're also starting from the jaw down in this neck region because the first and most important instrument that we bring to our clients is our voice. So we're starting with us. We're starting with how our singing can impact our clients and how we can bring it to them as well. So we're talking about resonance. This is where this vocal faults book that Tori recommended to me is phenomenal. Highly recommend. I did a lot of reading for this project. Talking about resonance, and something that also is different. A lot of times in anatomy courses, we're talking about what's there. Something that's important for resonance is what's not there. We're talking about the spaces. We're talking about the sinuses, where sound actually vibrates. And talking about the difference in circular versus longitudinal muscles. You've got like the buccinator muscles around the lips. You've got the vocal folds, which are longitudinal muscles. How do they work differently? Why are they built differently for their different purposes? And how should we be aware of these things when we're singing and when we're trying to get maybe our clients to form certain words, or when we're making certain vowel sounds that we're trying to get them to mimic? What muscles are actually happening? Because what if our client has an inability to match muscle movements, like with apraxia? Bringing that why into what we're doing is really important from this anatomical standpoint. And so we run through all of the different systems that are going on, the pharynx, larynx, speaking. And you'll notice this is our first ding, ding, ding in our curriculum here, whereas there's the clinical considerations. All these things that are underlined in the curriculum are probably going to be things that I want to bring up in those Friday lectures. How is this actually a situation that's going on? So having like a vocal coach or someone come in for this first Friday, I think would be awesome. Someone that's really, really, really trained in how the voice works and its strengths and weaknesses, ways to keep it healthy, etc. The next unit is also kind of a big one, but again, this is a prerequisite course for if you want to go into more further knowledge later. This is just required for a music therapist to get the basics of understanding. So talking about the spinal column and all of the different diagnoses that we might see there. Talking about the thoracic wall, and we're talking about breathing. We're talking about the thoracic cavity, talking about the heart. And this is not a comprehensive list. I would love to keep adding to it based off of different diagnoses that come up from future surveys from a larger pool of music therapists and other allied health professions. But a general run through of there. The abdomen would be a shorter unit, simply because we're not often talking about the digestive system with our clients. I mean, I have one client in particular that I see with Faith where the digestive system is something that's incredibly pertinent.
Yeah.
But most of my clients, it's not a big thing. So we talk about the basics. We'd use all the different names. Here's the colon. Here's what this means. But it would not be as big as maybe talking about the muscles and the diaphragm that are involved in singing in the abdomen region, bringing awareness to that. In the pelvis and perineum, I've given another disclaimer about statement of gender, sex, and diversity with the fact that basic biology is what we're studying here. We're not studying differences in intersex individuals. We're not studying differences in transgender individuals. We're just talking about cisgender bodies because I would love to also design a course for gender inclusivity and talking about how intersex and trans and gender nonconforming bodies look different than healthy young cisgender bodies. And depending on the political climate of the time, would also love to give resources for where more information can be accessed. Yeah, and that's kind of all that's going on there. Emphasizing analogous structures and why they're important, but then a big clinical consideration is that a lot of music therapists work in the field of labor and pain management and in like NICU, stuff like that, like all of the birth process. I think that's the most important part to consider when we're talking about the pelvis, when we're talking about a cisgender female body, what actually happens during birth, what structures are there to help it, and what kind of things are happening in our nerves for pain. Talking about pain in this unit is, I mean, it sounds awful, but far more important and pertinent to our practice. Then we're talking about the lower extremities. We're moving even further down. Now we're talking specifically importance of muscles and movements and what directions are things going, what's the correct terminology to use, and drainage. Our legs are a cute little pool that like to collect things. So a lot of our clients have issues with drainage, with the lymphatic system. Having a better understanding of what's actually going on there and how the circulatory system picks it back up to send it back to the heart is far more important than a lot of the other things that are going on in our legs. When it comes to the different diagnoses that are of the most served populations. Talking about the specific different parts of the legs, so say if we're working on a specific part of our leg with our client, we have a very specific approach. And talking about our joints, especially when we're working with individuals that are elderly. How are their joints actually being affected based on age, based off of the cellular makeup of connective tissue of that fascia that is between our bones? And then, of course, Parkinson's. This is actually one of the first things that got me interested in music therapy, was working on gait patterns with individuals with Parkinson's, talking about gait, talking about the gait cycle, and what's actually anatomically happening with our reflexive, what are they called? Interneurons in our legs and why it works. And talking about atrophy. Our upper limbs is going to be a very similar unit to the lower extremities, but it's more about specific, like arm extension, grasping terminology, things like that. Like if we're talking about our client grasping a rhythm stick or grasping a shaker, how is that going to be different than just saying grasping. Like, we can be more specific about which fingers are being used, which bones are actually moving or having a difficulty moving. And again, I apologize. I'm going very quickly through this, but I appreciate all of your questions and thoughts that are coming up. And then the head. This is a big one, but again, it is not a neuroscience class. We're going to be talking about all the different parts of the head, but more specifically about the diagnoses that are involved in our most served populations that are around the head, talking about hydrocephalus, talking about seizures, talking about Alzheimer's and dementia, what's actually happening with the gray matter in our brain, why is the gray matter there, stuff like that. And our face, this is something that I got inspiration from with working with Elaine for one session. What's actually happening in our face? Oh, and I forgot to mention, way back at the beginning, the first system that we study is the integumentary system. That's skin. And I wanted to give a disclaimer about inclusivity, understanding why does skin have different pigments, and why that might be something, when a first bias we should check when we're working with clients. How is their skin color actually changing anything? It's really not. So bringing attention to our biases before we get out into the field, from the science standpoint, understanding it's just the human body. The senses. This is a big unit. It's not traditional regional. Most of the senses happen in this part of the body, but I thought having their own unit was incredibly important, because with senses and sensory needs being one of the major domains of music therapists, I think it should get its own. So then we're talking about the different parts of the anatomy, talking about the sight, talking about taste, which we kind of already touched on with the oral cavity in the first unit, or I guess second unit, because the basics is the first unit. But now we're talking about teeth and the palate and stuff like that. I got inspiration for this because of learning about how tongue positioning is different for individuals with Down syndrome, learning about why that occurs. Scent and hearing, and this is a pretty cool thing. I have an aunt that works at the university of my alma mater. Her name is Dr. Tiffany Shelting. She's an audiologist and a clinical supervisor, and I didn't have time, and she didn't have time to let me pick her brain for all this information, but I would love to have her have a session, or reading one of those Friday clinical skills labs about audiology, because so many people on the survey said they wanted to learn more about deafness and hard of hearing. So many people, like 12 of the 17 marked that as one of their most important. So having extra information on hearing and cochlear implants and how that's all affected and whatnot is really, really important. And then our last unit here, the music therapy applications. This is where we're going to bring us back to the why. This is where we're going to be talking about documentation. We're going to be talking about medical competence, bringing in information from NMT. Of course, I do not want to do that if I'm not trained. I want to be ethically true to it. I would want to bring someone that is NMT trained. But these are some things we might talk about, bringing us back to the previous regions we've studied, talking about RAS and OMREX and all of the different things. And then this is something that I'll just read off, because I think it's probably the sender Homer, the right at the end of the class, that's really important. So, as allied health professionals, it is the duty of every music therapist to have a university-level understanding of the human body, the elements, regions, and how they interact with each other. Our primary role is that of a therapist. Music therapists have the unique scope of practice to address not only socio-emotional, cognitive, spiritual, and communicative goals, but physical goals as well. We cannot claim to be an allied health profession if we do not provide music therapy students with the tools needed to excel in their role in the medical field. So we're not going to be surgeons. We're not going to be like nurses, but we do have a specific role in the medical field. It's why we exist. It's why we're an allied health profession. So if we can make sure that our students are aware of their specific role in the allied health profession with the medical and health awareness, I think that is the capstone of ethics. As such, it is the responsibility of music therapy programs nationwide to properly prepare their future clinicians with an applicable and approachable understanding of the human anatomy that will be to the benefit of their clients, patients, and peers. Down here was a little pie chart that represented the survey that was collected for the music therapists and the populations that they serve. So that was my source there. It came from a larger document full of a whole bunch of information, but this was really pretty, and I thought it was an easier way to look at things. So for my conclusion, going forward, I'll bring it back up to this because this is big and important. I a lot of the courses that were music therapy specific at my university, you could only take if you were a music therapy major. You'd already auditioned, you'd already been accepted, and you're in the program. But I believe that this course should be available not only, well, first to music therapy students as it would be required, but next to anyone at the university as like a depth science class. Because one of the reasons that we have to continuously be self-advocating as music therapists, because people don't understand how hard we actually work and how much we actually know about the human body and its importance in our practice. So having students that are not just music therapy majors take it, they'll be like, oh, this is actually what music therapists do. They're actually an allied health profession. I think that's incredibly important to bringing more awareness around our field. And in terms of going forward for me, having this resource built, I think would help me become more marketable as a professor. Like I already see a need in the field. I see how I could approach it, and I would love to present it to you type of situation. And for myself going forward, I would love to get NMT training, but I would also love to get some type of medical school practice or a medical like understanding license, because I'm really, really interested in this kind of stuff. And I think if I were to have some type of medical schooling or something of a similar nature, that I would be able to bring even more power to this course and other courses that I might be teaching in the music therapy domains. And I believe that I have filled you with enough information, and I would love to know if you have any questions about the course or about specific parts of the course. Yeah, I would love to know what you guys think. Thank you.
Well, first of all, I want to be in your class.
I would love for you to be in my class. I would love to teach about all of this stuff. It's very exciting, and it gets me going. My hands are always cold, but my hands get warm when I'm talking about this. What's up?
I had thought about the senses section. I feel like we work a lot with proprioception, which is like is that like considered a sixth sense?
And vestibular.
Yeah. So I feel like digging into that a little bit.
That does go into like, I know like Alberto at least has a class that we do go into like proprioception and that kind of stuff.
I'm jealous.
It's very specifically
like
an intro neuroscience class basically.
Yeah, I would love to have something kind of like that in the sensory.
Yeah, I guess I don't know if it's senses or head, but something about that.
With your ears, but it is processed in your brain as a
Right.
sensory system.
It's such a weird thing, but we like target it a lot, especially like in NMT they talk about proprioception a ton. So
I appreciate that.
I think that was just a thought that I had. And also I had a question about like, would you dig into like common abbreviations of words, like for upper extremity, lower extremity? I always use UE.
I would love to talk about that a little bit, not go into great depth about it, but way back up there at the top in the basics unit when we're talking about the basics of learning the anatomy of the language of anatomy, also talking about some like common abbreviations for the anatomical terms or movements that we might use in our documentation to help speed up the process and build competence when we're reading other people's documentation.
I know we have a cheat sheet like that for hospice.
Oh, that's cool.
And so, even just like a key is super helpful.
Yeah. I feel like I feel like I know a lot of them, but I still run into like, could I use a different, or could I make this easier for myself by just using an abbreviation?
Sure.
Yeah.
What's up?
I feel like this was really great, especially for the medical setting. And like the medical terminology I found like was super important in my internship, because like this kid would show up with like something and I'm like, oh, that's itis, that's a kidney thing. It's a kidney thing. And then that saved me time with the Google search and stuff. And I also love the case study idea as a final project, because I think there's just so much value of going in depth on something. And we can be kind of scared to go in depth because we want a general understanding of everything, but there is so much value in going deep. That can teach about other things that you didn't expect.
Exactly. And I think having it in that like class file makes it all the more applicable, because then you don't have to do the work for all of these. You'll have a specialization on something that you're most interested in, but you won't have to be expected to know everything. You'll just have your classmates to help you out. And this one, I would have a couple different ways I could approach it. Either one is assigned to you, or like a first come first served basis. So then once something is taken, it's crossed off the list, so we don't have 4 different Alzheimer's, files in our class file. I saw Tori's hand first, but then I'll move over.
So for the final project,
Mm-hmm.
as much as I hate public speaking, would it be just a paper that they like put away, or are they doing a presentation on it? Because truthfully, if somebody's deep diving into something, you only know the information as much as you can teach it.
Yes, that is so true.
Like,
And
I hate public speaking, but I also see the value in, like, you have to be able to teach it, and that's the only reason I know, like, stupid amounts about vocal pedagogy.
Right. So I've got like the unit 10 right here, and in this conclusion and project time, I was either thinking of dedicating it to allowing class time for their peers to be able to work on their project in class, or if the professor finds it more appropriate, using those 3 class periods for presenting projects, either in like small little elevator talk ways, just to get people like, hey, this is information in my file, you should go read it, or with a more comprehensive layout of all their most important findings, or their most music therapy domain specific findings about each population. Thank you for asking. Yes.
Oh.
Go ahead.
Just a general question. Are like normal human anatomy classes that you guys take, is it like gen ed, like everybody's in the class, or is it like, I know it's not music therapy specific, but is it only?
Right. At least at my university, the anatomy course I was required to take was the same one that like nursing students and
Right,
and
okay.
majors were taking.
That's my
I will say my course at my school, they always instructed the music therapy students to take like a certain one,
okay.
and so we all actually ended up being all together, and the professor we had like always taught the course that most of the music therapy students were in, but it wasn't like saved for music therapists. It was just like,
okay,
we're gonna make sure you guys all sign up for
I
this
feel
one.
like in
So-
mine, maybe this is just because I am not a traditional student for music therapy, but I didn't even have to take an anatomy class. I had to take a Bio 101 class for the 3rd time.
Whoa. I have ethical feelings about that.
Like, they were like, oh, you're gonna just take bio, and I was like, okay, but that's not applicable. Like, me being able to grow plants, which I can do, great, fantastic, but I haven't taken an anatomy course since high school.
That's strange,
And
because
it was also like not a required course in high school, but it was like an optional.
yeah, I was required to take anatomy, but I also for fun took biology, chemistry, and neuroscience because I like those things.
Yeah.
I know when I went through Alberto's program, I had to do bio, I had to do chem, and then anatomy. But the anatomy class was like, because Alberta is such a nursing school, like the professor was like, in the hospital, you're gonna, it was so tailored to nurses.
Yeah.
And I'm like, with my guitar.
That's something I found in this textbook too. A friend of mine that's in, she's pre-med. She let me borrow her textbook, and it's really cool. Something I didn't even mention. There's going to be greater emphasis on surface anatomy than deep anatomy, because when we're looking at our clients, we're not going to see the muscles and what they actually look like. We're going to be like, oh, that muscle's right there. So being able to identify from the surface level is going to be a highlight on our unit quizzes. But something cool about this textbook is that it has all these little like boxes. Of course, now I'm going to find one. They're on like every page. There it is. These little blue boxes all talk about like clinical considerations, clinical applications, but most of them are if you're working in a hospital. And so if we were talking about those, we could be like, oh, if we were working in a hospital with someone that's working with these doctors that would be seeing people like this, then we might have a better understanding. But
I do feel like this just like bridges the gap between therapists and like medical professionals, and especially like for an art therapist, like we didn't require any of that. Like, my science class was earth science. So like, and this is actively a topic that I avoided because it's like not interesting to me. But like at the same time, I get why it's important, because there are times when I run into things where I'm like, I don't know what this means, and I don't know how to help it. Like,
sure.
And like there's a whole subset of art therapy that's just medical art therapy, and again, you're not required to learn that before
Sure.
you get access to that.
So Yeah, a lot of my peers, when they saw that they had to take anatomy for their curriculum, they were like, "Ugh," or like putting it off to the last minute because it's the same class everyone else takes. It's not actually going to be applicable to what we need. And so, with my last statement that I made in the curriculum about this being an approachable and applicable class, they're learning stuff they actually need to know, and it's in a format that they're actually going to be interested about it. They already are passionate about music therapy, so if we're pulling it back to the music therapy applications constantly, then they're going to be like, oh, this is actually why it helps. I want to hear your question.
So I just have 2 points. One of them is it would be really awesome for you to add a section about addressing the music therapist caring for their own body in their work, because we do get injured with redundant motions and stuff like that, and so the health and safety of caring for the music therapist. And this also goes because, like, for my thesis for grad, I'm doing like based on resiliency for MTBOs, but I'm reading into a lot of music therapists and like why they leave the profession and stuff like that. And one of the things like that was listed in an article was that frustration with the education for undergrad not being more tailored to what we do. Like, just like how we need to take functional piano or guitar. I had a guitar teacher that was teaching me how to do like classical runs. Who gives a crap? That's not
Right,
functional.
yeah.
So this is functional, and I think that that's huge to build into resiliency and application of what we're doing.
Sure. Yeah. Luckily, I got to take a guitar for music therapists class.
Nice.
That was
cool.
really
That is
cool.
Yeah.
What's up?
The pain gate theory could be something cool to explore in this course.
The what?
The pain gate theory.
Oh.
That's a pretty big one, especially like if you're working in the medical setting, or just also understanding how the senses and how your spinal cord and body process it and affects pain. I learned a little bit about it in the psychodynamic course I took at Oberno, but it's kind of a really cool thing.
Yeah.
So it'd be kind of neat to focus on that a little bit.
And I can tell that each of you guys have like your own areas of expertise, which is why I would love to have guest lecturers be at least a part of half of the lecture to talk about things, where I'm still going to be having the professor give some type of discussion on the clinical considerations. That's why the professor, perhaps myself, would be teaching this course because they have the training, right? But having the specialists talk about their area would be far more helpful than me trying to talk about a specialist area. I think that's brilliant. I've got 2 minutes left. Does anyone? Yeah?
I was wondering, when do you think that in their, schooling would take this? Because we were required to take anatomy really early, so that when later we took specific populations and neuroscience classes, it was a foundation to apply the knowledge. But since this is so integrated, I don't know. I'm just kind of wondering.
Yeah, that's a great question.
Yeah.
I was envisioning this either sophomore or junior year of a 4-year program in music therapy. Not the last thing, because I want people to have exposure to this before they decide they're going to put their whole life on this. Because this is real deal application. A lot of people come into music therapy, especially at my university, and they're like, oh, we're therapeutic musicians. We play music, make people feel better. But being like, no, this is a real job. It's a lot of hard work. Having this information right off the bat can help prepare them for, like, am I cut out for this? Am I, preparing myself, like, mentally for, the expectations of documentation and whatnot. Of course, I don't want to have it their first year, though, because when we're talking about designing an intervention or things like that, you haven't taken music therapy treatment yet, usually in the first year, or rather, you're just starting it. And so taking it at the same time as music therapy treatment, I think, would be tricky. Taking it after would be good.
I'm also wondering if I can ask another question.
Sure.
I feel like the professor for this would have to kind of be a unicorn, right? Because it's like you need to have the music therapy background, but you might also have to have really high level education in, like you were talking about going to med school and things like that. And I feel like for every university, it might be hard to find. Do you think
that is true?
Yeah.
I think that is a very good point, which could be a great marketable thing for, like, if I'm working at your university, I am best preparing our university for our music therapists.
And that would be a really good job for a really good program,
Job
You could also have someone, at least, like, not even someone that has, like, necessary, like, med school training, but even someone that has worked in a hospital setting and worked with, like, clients like this way more often would be probably more applicable than someone who is, like, just working in a very specific
at the very least, if we wanted to try and approach this problem of having the medical understanding as well as the music understanding, it could be designed that the medical lectures on Mondays and Wednesdays were taught by someone that's in the bio field, and then the Fridays are a music therapist taught.
That's
So
awesome.
then you could have all of the very in-depth, of course, the science guy on the Mondays and Wednesdays,
Yeah.
whether she knows it or not, is going to be teaching it so that music therapist can understand it with that disclaimer, so that when the Friday people come in, then it's much more up their alley.
Totally.
These are great questions. Thank you. I think that's the end of my time.
Thank
But thanks
you.
again,
Nice
guys. And if you have any other thoughts, questions, or brilliant ideas of things that should be included or left out, let me know. I want to give you